coronavirus pandemic is in the minds of everybody right now, and I think that there are many multiple sources of information. The one that I like the most to keep myself informed is the one provided by John Hopkins University, and they have this map that shows the total number of confirmed cases, deaths, and the total recovered. Very likely this number is very low compared to the total number of infections, maybe by a factor of 10 or more. I have been doing some calculations based on data mainly from Germany and South Korea, and I have come to the conclusion that the mortality rate of the virus that varies a lot. I mean, it's completely mild for very young people and deadly for people older than 60 years old, but it's about 1.1% or 1 in 100. The average number of days between the infection and the potential death is about 13 days. Now, this is the ratio that to from number of infections to confirmed cases that in fact shows how we are underestimating the problem. For developed countries, you have a ratio of 1 to 8. So, for example, 1 is for Singapore. They are really tracking the infections very well, but there are other countries that are not. And for example, even in the US, probably we are under testing by a factor of 8. And this one in the bottom, well, I'm going to use just in the next couple of charts to explain one of the real problems that we have in the US. This is Singapore based using that information. The red line is the one for confirmed cases. The green is the number of deaths. The blue is the estimated number of infections. That is really based on number of deaths, just multiplying the number of people who have passed away today, multiplying it by 100 and bringing it back 13 days. So that will tell you more or less what to expect over the next couple of days. But in here for Singapore, you see that really they are very, very aligned, both of them. Now, using that information, let's see what happens here in the US or where we are in the US. First of all, what you're going to notice is a big discrepancy between the confirmed cases and the potential number of cases. And the other thing that you're going to notice is how many beds, hospital beds, are probably needed right now, about 100,000, and how many are going to be needed in the next 13 days, close to 243,000 or more than 243,000. And of course, this might vary, and if we are doing a very good job of pretty much flattening the curve, as they say, we could see a lower number in the future, but as of this time, by around April 2020th, we should see about the need for 240,000 beds needed. And New York in particular has about half of the cases in the country, and this is worrisome. This is why people have to stay at home over there, because they are getting to the upper limit that what the government, the army, the health care providers can really come up in the area. I think that the limit is about 140,000 beds. Right now, we are looking at close to 112,000 beds in the near future, in the next 13 days. So we should stay at home, do our part, wear our masks when we go out there, and really hope for the best. Keep yourself safe.